with a wonderful, knowledgeable background of being a doctor, gynecologist, a fertility specialist, and a mother and an ultra marathoner, you know, kind of all packaged in one lovely combination. And it's a privilege to have this evening Ultramalaivasi live sessions. You are already an Ultramalaivasi. Will probably introduce the concept to the rest of the audience who are new to the concept in a short while. So where are you right now? Where are you located?
Vacation.
It's kind of, sorry, it's voice breaking.
I said currently I'm on vacation.
Oh,
yeah.
You're on vacation? Oh, okay. I hope it's okay to have this little, I think Instagram means it's vacation, so I hope it's okay. Okay, lovely. Why don't we get started? So why don't you tell us more, you know, with all these things happening in your life, you still seem to be cheerful and smiling, which is a very remarkable thing, because I know that work, family, and also a life in the world of ultramarathon running seems to be something that everybody wants to aspire, dream about. And suddenly we see a person like you who is sitting in the other side of the world, who's doing all those things at the same time. So what's the secret sauce? What are you eating? What are you drinking? What is the secret ingredient?
I think the first thing I would say is probably my head. You should want it really badly to make it happen. You should really, really want to do it inside your head. I think that's the primary thing. And if you want it so badly, somehow you manage to find that time. I mean, yes, I would say I run at really odd hours. That being said, it's not like 4 a.m. I've done my runs at 12 in the afternoon, and my lunch break in my evening, I've done it at 8 p.m. So, but yeah, you have to somehow manage to find time. But that only happens, otherwise you can find about 100 excuses not to do it also.
Brilliant. That's something very unique. And I said that you basically want to start, I think all of us want something in our life. All of us aspire to do something. All of us wish we had something else in our life. I think having that, you know, there's a lot of books that tells you that, okay, you need to have an end in mind. You need to have a goal in life. I think what's more important is what you said, right? So you need to be wanting to make it happen in your mind. I think that's the first thing that is very striking, very wonderful way to start this evening conversation. So now, you and I are connected through two reasons. One is of course, you love ultramarathon. I love ultramarathon. You've run the OOTYULTRA, and I'm happy and privileged to be the race director for the event and trying to create an experience for all the participants who aspire to come and experience the beautiful mountains of Nilgiris. You have done the OOTYULTRA last year, and then you also went on to complete the Comrades Marathon, which is technically the 89.885 kilometers. That's what you've written. That matters a lot. So why don't you tell us what basically, what drove you to think about running the ultra marathon, running the Comrades Marathon? Have you run any ultras before the Comrades?
No. Comrades was not even on my bucket list. I started training with a South African coach when I was pregnant, because through one of my trainers, when I got pregnant, I was very adamant that I wanted to run, and I wanted to train with a coach who trains pregnant runners, who knows how to do, because I wanted to be very informed about it. Even though I'm a gynecologist, I'm not a running coach. So that's how I got to know Coach Lindsay Parry. I started with him only when I was pregnant, and I continued, and then I think after a year or so, I found out that he's a coach for Comrades Marathon, and then I was like, okay, fine, I think we're meant to do this. That's how otherwise, I think up until 3 years ago, Comrades was not even on my list of to do. Even ultra running wasn't. And so,
no, so that's interesting. So you wanted to run, and then you wanted a coach who can coach you when you were during your pregnancy. Then that's how he came across Lindsay Perry. He's an amazing coach. He's a very inspiring fella. So if you're associated with Comrades Marathon, then everybody knows Lindsay Perry, right? So very young, energetic, and he coaches a lot of elite runners, and also he coaches a lot of common people, right? So it's brilliant. And then you wanted to be an informed runner. I think this desire to become an informed runner is the reason why a lot of runners who tend to become knowledgeable, they are aware of what they're doing, because that missing information is what also makes people sit at home and do nothing, right? Because when you want to seek information about, oh, okay, can I do this, can I do that, instead of going by and then bring in that expert to give you that advice, right? So that's why we need the coaches and the doctors, and it's really important that then many people are afraid, and especially many women are afraid to step out of their home because they have this unknown fear. They don't even know what that fear is because somebody else told them that if you run, it's going to hurt you. If you can't run, you can't exercise during the pregnancy time. I think you're a living example. And one more thing that you said, which is very important, which I like, is even though you're a doctor, you also wanted a coach, right? So that tells us that, and of course, you cannot assume that you know everything. And you went and want to seek that right knowledge and information, which is really, really inspiring. So now, going back to the question that I asked, before running the Comrades, have you run any other ultra distances, which is about 50 kilometers?
No, and I find this fun. But for running Comrades, I had run one full marathon.
One full marathon, okay, that's good. That's another myth busted, right? So that generally people tend to think that, okay, you have to run and experience it. But again, as a coach, I would say that this doesn't work for everybody, because you need to mentally prepare yourself for running an ultra marathon, which is 12 hours long. But so how do you do that? One is run the ultra marathon, which is 12 hours long, like the way you have done it, but also run probably shorter format races, and then kind of build up that mileage and also the confidence, right? So now
that was my first hill run, my first training run, my first hill run, my first ultra run. I mean, I ran the 30 because of the fear of the distance. I would have done the 60, but yeah, that was my first ever hill run. OOTYULTRA.
Okay, brilliant. So OOTYULTRA was the first ever hill run, and that gave you the confidence to run the Comrades Marathon.
Yes, absolutely.
Okay, brilliant. Because if you see Preeti Lala, who finished the 90K last year, she came and said that, hey, you know what, OOTYULTRA is a mini Comrades Marathon, right? And then, of course, that's her version of how she saw that event. And she did a 90K, right? So she's the only woman who had attempted the 90K in the first edition, and she's the only woman who has finished so far. See, originally the OOTYULTRA, the idea of OOTYULTRA was to take 3 of my clients to show them what it is to run in a tough mountain like the Nilgiris, and then make them, because I had experience, and I'm born and brought up in Ooty, I never ran in Ooty, but suddenly one day I realized that, hey, I'm in love with running, especially ultra running. Can I go back to the mountains? Can I experience what it is to run in the mountains, right? So when I did a 60K in Ooty back in 2000, that was in 2014, I was humbled. It was not easy. It looked so easy, but it was not easy. I was humbled, and I said, okay, I'm going to take some of my athletes to experience Nilgiris first before they go to the Comrades. That's how the OOTYULTRA started back in 2018, and then that experience is fabulous. So I haven't done a complete research, but I can tell you confidently, those who have run the 60K in Ooty, who attempted the Comrades, they had 100% success rate, because they all came back and said that. Because see, Comrades has its own emotions attached, right? There's no comparison between what Comrades Marathon has and OOTYULTRA has.
Runners, even the 30K. In fact, even my coach, when he saw the thing, he said, and I feel that if I can do this, I can definitely. I think Comrades felt like easier, quite doable.
Easier.
I think
Correct.
For a tough terrain. It really prepped me. And that was my first one. And there's a very because I was like 30K, 100%, I'll finish it within 3 hours, 45, 4 hours. I booked my tour. at 4 p.m. the same day, and I'm nowhere close to finishing that fast. I was like, Erika, run, or else you're going to lose that flight of yours. So I mean, not just 60K, but every distance. I think that the terrain, it's first of all, it's beautiful. It's beautiful. You feel like, why am I running here? Because it's, I think the whole route is very nice, especially when we come down to the tea estates and all. It's just stunning. But
Yeah, that kind of reminds me of something. It's actually when you say that you are somebody who admires beauty, and then at the same time you don't have time to admire the beauty, but there's a cutoff there. If you, so it's kind of there is a dilemma, right? If you're a runner, want to enjoy the nature, but also by running, but there's also an event, there's also some excitement. There is this sportsman inside you who says that, hey, there's some cutoff. I think it's pretty fascinating. I keep telling this again and again. The runners who experienced the OOTYULTRA the first years, they came to the finish line and said that, oh, you know what, Coach K, we've got, even if I pay 5,000 rupees to a taxi guide, he's not going to show me all these places. Okay, so it's very different. Okay, so I'm not telling. Okay, I can go on and talk about OOTYULTRA because I'm the guy who thought about this, but that's not the point. It's this idea of coming to the Nilgiris, coming to Ooty, coming to the mountains, and also experiencing through running. Only the running community can understand, right? And then I'm glad that.
should I stop to take that picture of or not? Should I stop again to take a picture or not? It's like constant battle that you keep doing. So
I know you can't. Yeah, we're trying to add more. What do you call more photographers? So you will not have time to even look down because you will look shitty in a picture. Right? So you don't want to do that. Okay, now I just want to switch gear to another very important topic. And you said that you're a mother of two. And I also had a chance when I called you. Listen to the baby voice. Baby voice. Okay, so let me be very. Only it's an inside joke between us. Anyway, so last year you did the Comrades, so that means your baby was 1 year old, okay?
yes,
And 1 year, just 1 year, 1 year.
yes,
Can you please tell me from the point of view of a woman who's delivered a baby, 1 year old, nursing and probably lactating and nursing, helping the child go through, and also at the same time you've got this monster goal in your mind of running the Comrades Marathon. How, first of all, there are two sides to this question, okay, two aspects of this question. One is this physically, biologically possible for a woman to do that? Or are you very special? Okay, so that's the first question. The second thing is, so what exactly is the kind of support system that you had at home? Okay, we will talk about that, but the first question that I want you to answer is, after a delivery, I'm assuming it's a normal delivery, okay? Hope we can talk about that because this is really an important thing that I want to ask questions, I want to find answers. So can you talk about this? Can you throw some light on, as a doctor, as a runner, can you throw light on this?
So a small correction, my baby was 2 years old when I
Okay.
ran Comrades.
2 years old, okay. But still it's young, yeah.
But so I think there are a couple of things. Definitely, number one, I'm not special. The only thing is that I was already at a good fitness level when I became pregnant. In fact, I was training for the Goa Half Ironman when I found out I was pregnant. So I was at a very, and then I continued through pregnancy, which led me, and after my normal delivery, I think because I was so active, forget about running, just being active throughout your pregnancy also gets you back up on your feet very fast post. So it's running, but anything, and the advantage of any form of exercise during pregnancy is much lesser than after pregnancy. The way you get back up and the way you get your body back into your routine, it's all seen depending on how active you were during the pregnancy. So that was my biggest gain. So when I was nursing, I nursed for about a year. And I continued my training and everything. I think the training was in simple words, it was very slow runs, run walks, very, very heart rate based. You can't let your heart rate and a lot of other things. So I think it was all of this that that led to that sort of an endurance. And something that I always say is, I think with the women, there's some sort of a different strength that comes after delivering a child.
Absolutely.
Because I'm a gyneecologist, but in your head, I mean, it sounds very funny, but I think that if I can do that, if I could go through that pain, I can an ultramarathon. So I think that's sort of a strength. There's a different sort of strength that comes with childbirth, be it whatever form of, but there is just something that cannot be matched. So it's not about me being special, but I think all the mothers have that strength. They just need to find it within themselves. Because multitasking, they are experts. So it's just about finding that strength within yourself. And I'm sorry, what was the second question?
Come to that, I've got a little add-on point to it. I said, so it's lovely that you acknowledge the fact that the women has that endurance, especially after the childbirth. You probably know that you have probably seen the worst, and then what worse can happen, right? So let me go through that, right? This is very, very amazing because I've had my wife talk about this, when we had our child. So she talks about this, and I said, hey, you know what? All the other things are absolutely nothing. I've seen the worst, right? I don't understand. Okay, for me, the worst pain that I have faced is when my wife started, kind of yelling at me and said that, oh, you know what? I've given a childbirth now. You please start. Make sure that you're supporting all of us, right? So kind of those kind of things.
Yeah.
And then maybe, okay, running a 90 kilometers, running 160. 100 miles, and those kind of pain I've experienced, but there is nothing. There's great respect for women, when we talk about this, right? And then also you mentioned that women are multitasking, which is absolutely true, especially in India. You've got all direction you're supporting, right? So you've got your child, you've got your spouse, you've got your parents, you've got your in-laws, you've got a work to do, you've got a career to catch up, you've got your aspirations. That is multitasking. Everybody is doing that, or everybody wants to do some part of it. Most of the things women are anyway covering. So the multitasking helps, because I think this toughness that you already have brought in, the multitasking skills that you brought in, and then plus you talked about you should want it to happen in your mind. And it's like so amazingly said, it stuck to my mind. That I think these are the combination of things I think that probably made you even think about running an ultra marathon, which is 90 kilometers long, without even attempting to do another ultra marathon, which is really commendable. The second part of the question that I want to ask is what kind of support system that you had, because that's really, really important. And I'm sure without that, you will not be at peace, and you can't leave the child unattended, that you need somebody to take care of the child. So how did that work for you, Dr. Erika?
I think support systems, I had my three biggest support system. Number one is obviously my family, my husband, who would let me go run. My husband, my family, nobody is a runner in my entire family. So sometimes it becomes very difficult to explain it to them that why do I need to do a 90. But I think over time they did they did accept it, because I think somewhere in their head, if she can run in pregnancy, I don't think there's any stopping her now. So I think they were quite supportive in terms of taking care of my son. Secondly, my running group, Chennai runners, Petai rappers, they were all, there were a lot of people from this entire running community who would come run with me, right, at odd hours, at 3 a.m. There's a whole bunch of people who came with me to, say, Yerkad for my long run. Just, they'll run with me in batches, because India being India, it's not safe for women to run alone, and I really did not have any other company. So there were a lot of people who gave me company throughout my training. And thirdly, I have to mention it, I have a nanny who takes care of my baby, and I think without her, I couldn't have done it. And I have to, I always mention her as a big thank you when I talk about Comrades, because it's a 2-year-old. So it's not like if I'm out for 4 hours, I really need somebody to take care, change diapers, do things. So that's how, that's the support.
Brilliant, brilliant. So it's lovely to know that you're not alone. in this journey. So certainly your spouse, your husband, very caring person, and also your running community. I think this is social aspect of running that all of us love, right? So you're not alone, and if you're dreaming big, and everybody is dreaming big along with you, right? And then at the same time, you had a wonderful nanny who took care of the child, especially the days, very demanding days, self-imposed, right? Say torture, we call it as, going and running long runs and traveling to different places, which is really fabulous. So I want to ask you a couple of questions regarding some of the. So this kind of I didn't know that this conversation will become a little more women's centric, and I'm kind of selfish reason for me to ask these questions because this is the first time I'm having a conversation with a gynecologist and also an ultra runner. So this combination make me excited about the whole thing. So what I thought, even a lot of, so the first ever time, okay, if you really look at the history of the OOTYULTRA, this year they get a 3% higher number of women runners participating. Okay, it's not a very big number, but it's a very good number. It's not a very big number. So I'm talking about 15% women runners to 18% women runners. I haven't really done the math, and we are just wrapping down. Yesterday was the last day for the registration, but I see there is a big jump, 3% jump in the number. Okay, so which is really good. So now that means there are more women coming out in the streets, right? So there are probably more nannies supporting them, husbands supporting them. This is really important, right? And so now, what are the most common gynecological issues that are faced by women, and especially running and gynecological issues, or being active, let's say, or just kind of remove the running from the equation, because running could probably scare people. If you could talk about, and one more thing that you said, and I want to bring it again here, that you were able to continue your journey to achieve your Comrades Marathon, running and Ultramalaivasi, because you were fit even before the pregnancy,
Yes.
right? I think that's a very important takeaway message. Is like, I've also seen certain women try to become fit after they start bearing the child, right? Now the child is there, and then I'm trying to lose weight, or do I lose weight now, or do I lose weight later? There is this chaos, misinformation. So, which is really awesome. So, what are the gynecological issues that are faced, or that possibly could be faced by runners or active women, during their life cycle? You can talk about a couple of them, and highlight what kind of things that they should be aware of. I think it's really good starting point.
So I think the first and the most important gynecological disorder that comes to my mind when I talk about exercise or movement is PCOD. Polycystic.
PCOD or PCOS, okay, all right.
The polycystic ovarian syndrome, because that is one of the most common disease that we see in women these days, especially reproductive age women. And I'm a fertility specialist, and almost, I'm not even joking, 60% of the women sitting in my clinic are
60%
suffering from fertility.
Wow.
So out of the 100 infertility women, at least 60 have PCOS. So that is the number that has increased. Even the incidence of PCOS in general population has increased, and a lot of it is associated with obesity and sedentary lifestyle, two things. And this leads to a lot of issues. First of all, you cannot get pregnant. If you get pregnant, you have so much of weight gain. If you have not been active before or done, that it leads to gestational diabetes, increased rate of cesarean sections, a lot of issues during pregnancy because of the bed rest, or sometimes people just don't do anything at all because of the fear of pregnancy. And I don't want to deny it, because it is a little scary to exercise in pregnancy. I don't take it away at all from the general public, but simple movement, like even walking for 45 minutes every day, is something that women don't do. And PCOS, PCOS, as I said, just doing 45 minutes of walking for 5 days a week, and the patient starts getting ovulating on its own, gets pregnant on their own. And we have seen that it's proven, it's written in our textbooks, that 5 days of 45 minutes of aerobic walk and you can get pregnant. So it's that simple. So and when it comes to running or being fit before, so there are two rules of running or exercising in pregnancy. You can do it if you were doing it before, and you have to get a clearance from your gynaec. So you can do anything that you were doing before, not just running. If you were weightlifting before pregnancy, you can continue. It's just about scaling it down. You don't have to stop anything unless and until there is no issue. But it's just that it is so much more important for women to incorporate movement in their life. Not running, not walking, not just being active.
Yeah,
Not for losing weight.
Movement is privilege. Movement is privilege and incorporate movement. Yeah, that's fantastic. Mm-hmm.
And it's not about losing weight, it's just about being fit. The moment we change our mindset from I'm doing this to lose weight to I'm doing this to be fit, I think you automatically will become better at whatever sport or whatever activity you've chosen.
Okay, now that's well said, right? So, in my language of my philosophy of coaching is when you try to do anything in excess, when you try to do achieve or accomplish certain goals which are like life size, but then suddenly you look down and see that you have the foundation, right? So the fixing the foundation is something that I really incorporate in my coaching. So what you are telling is before even becoming a pregnant, make sure that you are fit enough to carry the pregnancy. Right? So I think this seems to be a good advice that women can kind of seek a gynecologist, somebody like you who's also not just a gynaec, but also an active person. It's a very important message. So don't allow the body to go through a confusing time, gain weight and then kind of struggle through, because seemed to be a prevalent problem. And he says 60%, that's quite scary. I was not aware. I thought it's kind of an isolated problem, but this is very scary. And then this is all related to lifestyle, choices. And then when you say obesity and sedentary lifestyle, unable to move, various reasons, right? So there's no judging here. But I think incorporating that 5 days, 45 minutes movement can get you pregnant. That seems like you can probably put the phone and say, walk 5 days, walk for 45 minutes to get pregnant.
Textbooks also say that just like a 5% loss in weight or even a little bit of movement. And more than getting pregnant, PCOD has a very disastrous long-term implication, which is diabetes for life. Women who have PCOS at a younger age are more likely to get diabetes
So
when they're older.
how young, when you say ovulating age, and it's like how young girls are affected by because
that is what is scary, right? Earlier we used to see PCOD when we were seeing women at 24, 25, and now I have 16-year-old girls being brought by their mothers having PCOD and not getting periods and irregular periods and excessive weight gain. And so the age is decreasing and decreasing and decreasing. That is why we are trying to spread this message of exercise.
Okay, and for a layman's understanding, so can you please describe what PCOD is, and also maybe we should have started with that. What is PCOD, and also what are symptoms? How can somebody understand what PCOD is?
In a simple language, PCOS, polycystic ovarian syndrome. Yes, polycystic ovarian syndrome, and the most commonest way it is diagnosed is irregular periods, or not getting periods on your own and having to take any medications, or having a lot of acne on your face. A lot of young teenage girls have a lot of acne on their face and irregular periods. That's a diagnostic sign of PCOD. Excessive hair growth, or and then when they come to us, we see on the ultrasound and we see the ovaries, and they have a lot of cystic areas. That's where the name comes from. But basically, it is basically a syndrome of hormonal imbalance. So the reproductive hormones are haywire. But it is also insulin resistance also. So that is how exercise and nutrition and weight loss comes into play, because then the insulin and the glucose hormones get regulated and it all reverses. But it's a
So
very
brilliant. I think
reversible sort of a disorder.
And I'm assuming once it is detected, there is proper treatment available, and then they can reverse this condition. Okay, so that's promising, okay, because that's really important. There are certain conditions you need to live with. For example, when you say diabetic condition or blood pressure, some aspect of that can be reversed. So it's good to know that the PCOS can be reversed. All right, so I didn't realize that we've already done 35 minutes, and I feel like going on and on and on. It's quite knowledgeable for me personally, and I'm sure those who have joined this conversation also are benefiting. This is probably one of the most engaging conversation that I've seen, about 23 people watching, which is really good. Okay, so I've got two more questions, if you can help us with that, Doctor. So running through periods, and I think it's the most common discussion topic, and especially for women, and especially the performance race. So tomorrow there's a race, or let's say OOTYULTRA. There are some women that are coming, and then suddenly they realize that they are getting a period, because you can't. The marathon calendar is fixed, right? So it's not that it's fixed based on the period cycles, which is kind of not possible. Now, do you advise? What's your advice for women who might experience periods during that time? So, as a race organizer, you can tell me, apart from having some kind of medical preparations, what kind of thing? I think so something that I would like to talk to you later. But for the women, so what's your advice?
So for the women, I would say two things. There is one set of women who do not have that severe period pain or severe bleeding. Absolutely, go ahead, run. I run throughout my periods. There are some women who have excruciating pain and excessive bleeding. It's okay to take that first, second, third day off and not run. But it is completely onto you. There is nothing wrong that happens if you run during your periods. I think, I don't know if you know Utah Pipig when she won the Boston Marathon.
She was, yes, leading.
Right?
Please.
So, not that it affects your performance. It does not. It's on your comfort level. It's absolutely on your comfort level. And there are certain phases in menstrual cycle where your performance is high or your performance is low. But during periods, no harm that happens. That is what I want to say. People think, oh, I can't run. No, if you want to, you can. But
okay, and maybe not sure if it's a very relevant question. Do you suggest women who are experiencing periods and also at the same time they are interested in running to go and experiment or do running during that period just to understand how they feel? Will that be a general advice, or it's all very specific to?
No, you can definitely try it on, just to get that fear out of your head.
To get the fear, okay, all right.
And I mean, nowadays there is a lot of, and as you brought it up as a race organizer, I think quite a lot of races, including the Chennai Marathon, they have women's stations. There are sanitary napkins. There are tampons. There are certain things that are available. There are certain areas for women to change and things like that. So I think you should go informed. You should go informed. If you think, okay, this particular race does not have things, or there are races, I mean, who they don't even have a toilet, then no, I would not go there in my periods. But there is no harm that happens. It is not going to affect anything. Yes, if you're bleeding a lot, hydrate a little more. That is my only advice, but you can definitely run in periods.
Okay. Brilliant advice. And I think we kind of ran through a lot of things about you, starting with you as, having this will and then something written in your mind that you want to make it happen. And also how you basically experienced running an ultra marathon. So let's kind of talk about what really happened in the last 10 kilometers of Comrades Marathon, if you can describe.
Oh my God. I think if I remember what happened, how it's like all a blur in my head. And I remember that it was really cold at the beginning, and we had these layers which we threw away, and at 65 it started raining, it became really cold. And but yes, I mean, I think I chant a lot when I run.
You sorry, you?
Chant a lot. Like I
Oh,
chant Hanuman Chalisa or something like that. I'm like that. So I think last 10 kilometers it was a lot that, and sounds very funny now when I say it out loud, but I was okay, Erika, you will not see your watch till you finish saying it 11 times. And then I would start it, and I don't know where my mind is going. Then suddenly I'll come back to it. Oh, did I finish it? Oh, was I on the second one? Oh no, let me start from the first. So I think it's all about keeping your head occupied and just getting it done. But yeah, it was quite a stressful, because Comrades you have to finish in 12 hours, right? So, and for me, I think it was 11:45 on the clock. Match time
nice.
was some 38 or something. But you have that stress, right? Okay, no, I cannot walk. I have to run. I cannot walk. I have to run. So I think that, and fixing this is something that my coach told me last minute, is that if you decide on doing a run walk, stick to it. If you decide 4 is the walk, 4 minutes walk break. You can't change it to, and then no, I will walk after that. Do that. So I think if you stand or stick to a pacing strategy, more likely.
Yeah, but that's so important, right? So that's what your training is all about. You know, training is basically to help you condition, prepare yourself. You're physically ready. Your mind is anticipating things. And of course, in the marathon day, you're going to experience something that nobody can even teach you or explain you, right? You can't. I can relate to that, but I can't understand what you've gone through, right? I can't say that, oh, I've run the Comrades, I know everything. Not like that, because each one of us experienced something very, very unique and magical, right? One question that I ask with every ultra runner is, what point in time you felt absolutely shitty about doing this?
I think at 65th kilometer.
Okay. Wow. All right.
Yeah, I think around 65, 70 when it started raining. And
That's the point down, climb down and then, right?
yeah, because I think what happened is I knew there's a down that is coming, but it was just not coming. I'm like, where is the down? Where is the down? I actually saw some green number and I was like, can you tell me when is that downhill coming? And he said, just keep running, just keep running.
Take a deep breath and then keep moving. Okay, fantastic. Dr. Erika, this is wonderful conversation, very, very informative, educative, inspiring, and also a lot of hope, I would say, especially for women. And I'm planning to kind of convert this video into a YouTube share, and then I really want to share it with my clients, and also all the women runners who are going to run the OOTYULTRA, and also all the women runners who are running and being active. There's a lot of ideas that you have given, a lot of, I think it's really important for women to talk to doctors like that. Okay, so certainly this is not a paid promotion. So I'm not promoting Dr. Patel. Okay, so, but I think it makes sense, right? So you never asked me to do that, but I somehow feel that the challenges that I have faced when I go to an expert, when I go and say that, doctor, my knee hurts, my toe hurts, my hamstring hurts. So most of the time what we hear is, don't run.
Don't run. Yeah.
Don't run. Why are you running? You should be chilling. What's your age? Oh, okay, I'm 48. Okay, no, just relax. So I don't want experts, the so-called experts, to give that kind of a feedback, because they need to integrate our life aspirations. You said, because the doctor needs to know what is there in your mind. Because you said that you had something in your mind. The doctor must know what's there in your mind, and then they can give you the right advice. Don't run is not the right advice, because I'm also into these science of running and science of sports and how things work. And then there's a lot of research done in the injury, preventing injury is most important things, but going through the injury phase, rest is not the answer. Okay. I think this gives a lot of answer to most of the questions that women runners, those who are in the kind of fence will be able to appreciate. And then I think they can reach out to you. So you, Dr. Erika Patel, you've got the Instagram ID. They can message. I guess you live in Chennai. You practice in Chennai. So where is your facility, doctor?
I work at Art Fertility Clinics in Nungamakam.
Okay, so that's where they can meet you. Fantastic. All right. So the last leg of our conversation. So are you running the OOTYULTRA this year?
Yes, absolutely. I'll see you there on 2nd of
April. 30 or 60?
30 again this year.
Okay. And are you doing the Comrades once again?
Yes, I'm doing, but I hope nobody from my family is logged in because I'm yet to talk to them and tell them that I'm doing it again.
They did not see you saying this today. Okay. I've got something to say that. Okay. All right. Because that's a ritual, right? You do a back-to-back in Comrade, but I think not so good this time. It's going to be 2 downhill runs, right? So back-to-back is, yeah. But I was privileged to do a uphill and a downhill. So fantastic. So wish you good luck and love to see you, post you at Booty. And I'm sure those little experiences that you've shared are very valuable for many who was there with us throughout this conversation, also who will watch in the future. I wish you good luck, doctor. I wish that the medical community, more and more people like you also love sports and encourage those not so well injured, sick, confused, chaotic, also to encourage them, give them hope. Right? I think it's really important that doctors and the medical professional can give them hope by integrating their ideas into their medical practice. Okay, so with that note, I would like to thank you so much for being with me, and it's a fabulous session. It's one of the best discussion that I've had ever since we started this Ultramalaivasi Live. Everything is unique, and this was very different. Thank you so much for your time, though.